We had our first imported case in February, and very quickly we could see that we were starting on the exponential increase. So the disease was transitioning from imported cases to local transmission. And that was a point we realized that we only had a few days to make a decisive decision. And this is basic risk assessment, risk management. Our risk assessment was that because of the nature of spread, the high level of it's highly transmissible, the virus, and also there's considerable transmission from people, particularly in pre-symptomatic state, that we needed to act quickly to avoid following the trajectory of many countries around the globe, where the virus was seeded, and initially you see very small numbers, but you have a window of opportunity. So that was when we acted, and today is actually very symbolic because exactly 1 year ago today was elimination day for New Zealand. So we went into the most intense lockdown that we could do. It was by even using the Oxford Stringency Index, it's very high on that scale, approaching 100%. And that was a courageous move by the government because at that point, when they made the decision, we had only 102 cases and no deaths in New Zealand. So they were basically listening to the science and saying that is going to give optimal protection for public health in New Zealand. We weren't sure about how effective it would be or the other consequences. But that was our political leaders basically followed the science. We'd done the modelling for the government about the likely impact of a poorly controlled pandemic in New Zealand, or one with even moderate control. And that's when our leaders decided to follow that path. Our goal in elimination, or our goal in going to lockdown, was to eliminate the virus. So and our proposal to the government was to have a short, intense lockdown with the explicit goal of having no transmission in the community. And we emerged after 7 weeks of effectively a stay-at-home order with no virus in New Zealand that we could detect. And we contrasted this with the alternative approach of going in and out of lockdowns for an indefinite period until there were other interventions. And of course, at that stage, the options would be effective vaccines and or effective antivirals or very good therapeutics that would make the disease more manageable. But we said, look, the big benefit of going into an intense lockdown is that we we have zero COVID in the community. Initially, and this is, I guess for me, a key moment about a week prior to this was New Zealand introduced a 4-level alert level system that we'd adapted from the system being used in Singapore. And the debate was, yes, we would have this system and we would work up the alert levels as the pandemic got more intense to basically mitigate it more effectively. And myself and some colleagues argued very strongly that we should do this in the reverse order. We should start at the highest level of containment to basically eliminate the virus rather than going in the other direction. And so we just turned it on its head, and that's actually what the government adopted.